Right after the patient leaves the consultation room, I often have family members return to ask me a crucial question. What is my risk of cancer because my family member has been diagnosed? This is such an important question, and the first thing I want to say is this. Having a family member with cancer doesn't automatically mean you'll get cancer too. In fact, only about 5 to 10% of all cancers are hereditary. So, what really affects your cancer risk? There are three key factors to consider. First, how closely related you are to the person with cancer. Parents and siblings matter most. Second, the age when your relative was diagnosed. The younger they were, the more it might raise your risk. And third, the number of relatives in your family with cancer. Now let's think about family history for a moment. Back in the day, people rarely talked about cancer. It was almost like a family secret. Genetic testing wasn't available, and sometimes all we'd hear was a vague diagnosis like brain cancer or stomach cancer without knowing the exact organ involved. Even with these challenges, modern genetic testing has transformed how we assess cancer risk. For example, if a young breast cancer patient tests positive for a BRCA mutation, we follow specific protocols to test their relatives and take preventive measures. These tools have made it easier to make better decisions even when family history is incomplete. Now let's talk about hereditary cancer syndromes. These are genetic conditions passed down through families that increase the risk of specific cancers. Here are some of the key ones you should know about. First up, BRCA mutations. These are probably the most well-known thanks to Angelina Jolie's story. They significantly increase the risk of breast and ovarian cancers. Next, there's Lynch Syndrome. This increases the risk of colorectal cancer. Then there's Lee-Fraumeni syndrome, which increases the risk of cancers in multiple organs. FAP or familial adenomatous polyposis causes hundreds of polyps in the colon, which can lead to cancer if untreated. And finally, von Hippel-Lindau syndrome, a condition as complex as its name, which increases the risk of several types of tumors. Now, how do you know if one of these syndromes might run in your family? Here are some red flags to watch out for. Cancer showing up earlier than usual, like breast cancer before the age of 50, multiple family members diagnosed with similar cancers, like your mom, aunt, and grandmother all having breast cancer, one person developing multiple different cancers, like being diagnosed with both breast and ovarian cancer at different times, or specific cancer patterns running through your family. Here's the good news. We can test for these syndromes. Genetic testing helps us identify whether a specific mutation is present, which allows us to take targeted, proactive steps to manage or even prevent cancer. It's also important to understand the difference between hereditary risk and familial association. Hereditary risk is caused by specific gene mutations, which we can test for. These usually appear earlier in life and often affect multiple family members. Familial association, on the other hand, is when there's no specific genetic mutation, but multiple family members are affected. This is often linked to shared lifestyle or environmental factors and usually appears at the normal age when cancer develops. So why does knowing your cancer risk matter? Is there anything we can actually do to prevent it? If not, wouldn't this knowledge just cause unnecessary worry? Understanding your risk empowers you. It means you can take proactive steps like increasing screenings or chemo prevention strategies. We'll explore these in the next video, so stay tuned.